I'm 67 years old. I've had heart problems in my family all the way back on both sides to my grandparents. From the first time I took the EECP, I had stents right after it. And when they went back in, they found out that the capillaries had regenerated. I have noticed such an increase in stamina. I am actually up to the point right now to where I'm walking 4 to 5 miles a day. It's a program that I would highly recommend, and I would highly go through it again if I have to. People come in for what they call a tune-up. And, you know, I more or less think I came in to get revitalized this last time, but I would come back next year if I feel myself going downhill just to get a tune-up.
I am 62 years of age. I was the second patient that had EECP here, and it has been the most wonderful thing that's ever happened to me. I can tell you for sure, and I'll probably tell you several times, I wouldn't be sitting here now if it wasn't for this program. So this was my only hope, and it's been a real blessing. When I came in, I couldn't do 3 rounds on a stationary bike. Couldn't do 3 pedals. And I'll say, do you know how many miles I was doing after I couldn't do the 3 pedals? Would you like to guess? 10 miles. I was doing 10 miles in 50 minutes, 7 days a week. It was so shocking to me because it was like, I mean, my whole world turned around. It's like, you know, your whole world has changed, your outlook's changed. You're thinking, hey, there is something left. The doctor said, no, there's nothing more. Yes, there is. And it's right here in Winchester.
You lay on a computerized table for an hour a day, 5 days a week for 35 days. They put what looks like big blood pressure cuffs from your thigh all the way down to your ankles. Every time your heart is at rest, these things compress, force blood up the legs into the heart, and then when your heart beats, they relax. And what this does is forces the heart to grow capillaries around the blockages. They call it a natural bypass. The EECP, I mean, it's done tremendous, because in late 09, early 010, they said the best I had was 1 to 2.5, maybe 3 years to live, period. No ifs, ands, and buts. And it's been almost 5 years now. I tell them to jump at it. No, I wouldn't even give it a second thought. I mean, it does so much for you. I wouldn't even be sitting here talking now if it hadn't been for the EECP.
And I was all for it because, you know, anything to help me get on my feet again. The heart pains kind of dwindled down. And about the 3rd or 4th treatment, then they all went away. And I could walk up and down the halls here, and everything was much different. I think it saved my life, really.